Hello, just checking back in for the Convoy 19 update. I'm dog sitting. This is my friend's dog. She wants to get in on this today. Now, picking up again from yesterday, briefed on billions of economic losses. According to an economic analysis contained in a document labeled Senior Brief Level on Convoy 19 as of February 20th, government officials have estimated billions of economic losses and virus was poison. Billions in economic losses the virus was poisoned to trigger. It wasn't declared a global pandemic until March 11th. Among the points included on the economic analysis was the world economy would take a 280 billion hit in the first quarter of 2020 because of COVID-19. The direct impact on the aviation industry was already looking to be worse than SARS because of the higher number of flight cancellations and reduction of passenger seats, citing the International Civil Aviation Organization report that estimated up to $5 billion in losses in the first quarter. And imports from China would be down in the first half of 2020, which could impact the retail of wholesale sectors, while disruptions in exports would heavily impact a forestry of mining and agricultural sectors. Scramble to send China supplies. Another prepared and updated note stated that China had indicated it was a short of supply of personal protective equipment. Then the items requested were not in Canada's stockpile of relief symptoms, so the Canadian government went to the National Emergency of Strategic Stockpile and the Canadian Red Cross to procure the requested items, such as gowns, masks, and protective clothing. A separate email dated January 31st indicated the stock that they were looking to send China included PPE that was set to expire in February and March, and that the donation would be made without compromising Canadian supply. The email also discussed the possibility of putting supplies on the reparation plane departing from China. We have some stock in National Emergency Stockpile that we're able to donate without compromising Canadian supply. Oh my goodness, we don't want to compromise Canada for China, especially when they put us in this mess. Rumor has it anyway. It's hard to say without knowing for sure at this point. Batman does fly around the world like Santa Claus, you know. Looking for concurrence as soon as possible, so that when we get logistics underway, reads one email from the Chief of Staff of Public Health Agency of Canada, Maureen Johnson. In the end, that did not happen. Rather, it was sent in cargo planes with the assistance of the Canadian Red Cross. An additional mention of the supplies offered in China said the estimated value of February 2nd, just days before they were sent, was 500,000 big ones. Wow, that's a lot. The official release from the government about the supplies issued on February 9th said that Canada had a week prior sent approximately 16 tons of personal protective equipment, such as clothing, face shields, masks, goggles, and gloves to the country to assist in China's response to the outbreak. Since then, both the Bank of China and UAE donated thousands of medical supplies to Canada in return. The bus drives on Old Highway 2 after leaving the Yukon Lodge, which will temporarily house passengers from a charter flight to the center of the global novel coronavirus outbreak in Wuhan, China, in the CFB Trenton. In Trenton, Ontario, on February... Shout out to my Trenton homies. You know who you are. Anyways, on February 7, 2020, the Canadian Press, Justin Tang. The documents include a series of emails, which summary allegations between Defense Minister Harald Sahan and the Chief of the Defense Staff, Jonathan Vance. Vance is Canada's top soldier, while providing updates and seeking approvals related to planning and repatriate hundreds of Canadians from Wuhan and quarantine them in Trenton, as well as future plans to bring additional Canadians home. Part of the discussion was about the prospect using military aircraft versus chartered commercial flights. In one email dated back to January 29th, more than a week before the chartered planes were sent to China, Sahan indicated he didn't support sending military planes, and that Global Affairs in Canada can have a southern contract option. To which Venice replied, "Roger, sir." Ultimately, the chartered flights, non-military aircraft, brought those Canadians home. Oh my goodness. Other Department of National Defense documents include operational and logistical information about the Wuhan reputations, as well as the detailed timelines for the missions. For example, it includes photos of the facilities on base, flight itinerary, and examples of meals served. One image showing a tray of the juice box and pudding cup, among other items. Maps of where they would be staying. It also details the military's responses from the departure and medical screening process, as well as the documentation of the base afterwards. A similar government operations center plan was presented for the Diamond Princess passengers staying in Cornwall, Ontario, as well. It included considerations for providing those in quarantine with more clothing, as well as games and comfort items. Other emailed Social Hand region at events to get more information on late February about members of the military who are impacted by the coronavirus. This included one cadet that was informed by health officials that they had been on a domestic flight with someone who had tested positive for COVID-19 after return from Iran, which then resulted in 3 other close contact cadets going into isolation. Now here's a letter from quarantine. Among the documents is a letter which appears to be from someone who is in quarantine after being separated from a Diamond Princess. The letter went to Public Health Agency of Canada and appears to have eventually made its way to a hiding base and heavily redacted email chain containing the initial letter. In it, the redacted author is seeking more transparency, including daily reporting on whether anyone in quarantine tested positive or was symptomatic, and whether they would be tested to inform a peace of mind. Please appreciate that our back to quarantines and reputation have been extremely stressful. Apart from the loss of personal freedom, it is the uncertainty of not knowing whether one is infected, the consequences of infections, and time of quarantine and processes weighing us down. One person wrote this. It appears Member of Parliament responded to this email. As it referred to a letter and coming from a constituent, the sender was ridiculous. I am glad that you are home and the ordeal will end soon. I want to thank you for your tremendous good honor and patience through this whole nightmare, the response read. Early briefs about the virus. The Chief Public Health Officer of Canada, Dr. Theresa Tam, participates in a press conference along with the Minister of Health, Patty Hajjo, Left Deputy Chief Public Officer, Dr. Hayward Nahu in Ottawa, Sunday, January 26, 2020. The Canadian Press, Justin Tang. Based on a series of suggested responses prepared by various documents to questions about the coronavirus updated in late January, the government's knowledge of the disease was much more limited at present. At one point it stated that in time the remainder unclear how easily the virus could spread from one person to person. Close prolonged contact, like what you would expect to occur within a household, seems to be required for transmission of the virus. Not now, I'm reading the news. Anyways, here's one prepared response. This has since been shown not to be the case. It's quite dangerous, you see. This is why I'm sitting at home reading my own news. Make things more interesting, spice it up a bit. The advice from the frontline health staff is to look up for anything unusual in travellers, but officials do not think healthy travellers should wear masks while visiting China or any of the quarantine cities within that country at that time. Within a week of the government's advice to Canadians in China was considered leaving by commercial means their trip wasn't essential. Facing questions about the rolling virus to Canadians about COVID-19 and why some measures are being implemented later than in other countries like wearing masks, Dr. Tam. Oh, come off it. I'm busy, people. I'm reading the news. It's continued to emphasize the research of the virus has... Oh my goodness. Alright. Well, at least my friends are alive. That's all I know. At least they're doing fine. Okay. Where was I? Tam has continued to emphasize the research into the virus and its spread about improving day by day, and said federal advice to Canadians will continue to be updated. The latest example of this being Dr. Tam's positions on Canadians wearing non-medical face masks when in public. Consular considerations. In one heavily eradicated document from the Global Affairs Canada, the Preparedness and Foreign Affairs Minister Francois Philippe campaigned for the conversation he had with the Chinese counterpart Wang Yi. A section labeled Counselor Cases was eradicated except for the line stating among the objectives of the call to emphasize desire for ongoing access to Canadians in detention throughout the coronavirus situation. The key messages suggest that the minister of this document included encouraging China to maintain a transparent approach with international partners. Recently, China's handling the outbreak has been quite questioned by some, as the level of openness about the death toll in that country. Similar documents were provided to the committee detailing background given minister for calls with his French, Thai, German and Japanese counterparts. An unredited question in the notes prepared for campaign's call with U.S. Duty Secretary of State Stephen Biegun. It also appears Canada was asking whether the U.S. was having similar challenges with their cancer cases in China. It is unclear whether this is in reference to detained Canadians Michael Kovig and Michael Sapor, whose rights Chinese authorities are saying being protected amidst the pandemic. Anywho, now moving forward to the Department Redacted prompt concern. The protection order to release these documents specified that it's necessary redactions to protect Canada's privacy and personal information, as well as that of the public servants working on the file, would be made by the Office of the Law Clerk and Parliamentary Council of the House of Commons, whether according to a letter sent by Law Clerk and Parliamentary Counsel Philip Differency, whose reductions were done by the departments before they were produced. In addition to the personal information and privacy blackouts, further eradications were made to avoid injury of international relations as well as relations with provinces and territories. To protect information considered a Vice Minister, the protection of government assets, and to protect solicitor-client privilege, according to the Canada Health Deputy Minister Stephen Lucas in his submission to the committee. The government's primary objective in this exercise is to disclose as much information as possible that is irrelevant, Lucas said, adding a great deal of effort and expense went to the production of these documents. The primitive redactions done by the department appear to have led a meeting between Difference's office and the departmental representatives, where officials expressed concern about providing an unredicated information that typically would have done from disclosure. It was the law clerk's view the House of Committees are the approximate authority to determine whether any reason to withhold documents would be accepted or not. Oh no, that's never a good sign. Anywho, it's now up to the members of the committee to contemplate whether they're satisfied with the documents eradicated in the departments. Editor Senior Web, Producer Mary Necessin, Visualization by Mahama Singh. Correction, the earlier version of the story incorrectly identified Health Canada's Deputy Minister as Stephen Lewis. Okay, now let's just move on to the amount of people who are sick right now in Canada. Let's see what the new statistics are on that. COVID-19. Update. Okay. So. People who are sick. Who are sick. The number for Alberta. Let's check out Alberta. That's where I am. Howdy. In Canada, there are 18,477 confirmed cases. In Alberta, 1,373. Calgary zone alone, 835. Edmonton zone, 358. In the central zone, there's 66. South zone, 22. North zone, there's 90. And unknown, there's 2. I don't know how unknown would be the case. Maybe rural or something. In total in Canada, there have been 401 deaths. In Alberta, there has been 26 deaths. Recovered cases in Alberta, 447. Completed tests, 67,117. at least we're reporting our health to the authorities so we know we're good or not. At least most of us are surviving. Like, I heard the animals can get it. This doggy's a trooper. He's not getting sick at all. Right, puppy? Anywho, that's my news for today. It's 12 Gauge Page. Stay safe, stay inside.